Hey, good afternoon, Future Gen. This is Dr. Stan, and I'm coming at you with our theme of the month for April. It's called Back to the Root. And so what we're going to dive deep into this module or this theme about is basically how to get to the root cause of your health challenge. And this is not just focused on kids, it's not just focused on prenatal chiropractic care, it's not just focused on anything in particular. It's really just focusing on the principles of chiropractic, specifically as it relates to the regions of the spine, the segments of the spine. And when we actually dive deep into this, what you will then realize is how chiropractors have really delineated themselves from a lot of other professionals. In a lot of respects, it's not always been the best delineation, in that there's a lot of misconceptions about chiropractic, in that there's so much discrimination that was calculated by the AMA, the American Medical Association. They were actually found guilty for an illegal boycott against chiropractic. They had this strategy to contain and eliminate chiropractic, and that's made a lot of the perceptions and misperceptions mainly about what chiropractic actually is and what chiropractic actually isn't. When you get into the roots of chiropractic, on the back of my card, it basically says medicine is a study of disease and what causes man to die. And chiropractic is a study of life and chiropractic is a study of health and what causes man to live. And I couldn't say it more clearly than that. Then it's really about whether or not something is the study of the problems of life and something is studying the actual presentation of health and healing. And so when we dive deep into this theme, we're actually going to take the spine segment by segment and actually educate you on how each segment has a specific focus on how it controls, perceives what actually functions in the body, and adjusting those areas has this very direct effect on certain areas. And when we actually adjust certain areas, it's not just like, oh yeah, I feel better and my neck actually moves a little bit better. It's actually a very clear understanding of how, well, I'll just put it this way. This week we've had so many, just this week, right? In 1 week, we've had what most medical practices would call miracles. And when we say miracles, they're patients that are saying that, they've had decades of stress and decades of fear surrounding just movement because of how much pain and dysfunction they would be in. We've had patients with autoimmune conditions that have started to kind of move into this remission type state where, decades of therapies and challenges and all these different kind of trials that they've been through in the conventional medical system, that for us, we see on a weekly basis, on a daily basis, these miracles that happen. And it really comes down to whether or not we ask the right questions or the wrong questions. And I'm finishing the blog for this month, and basically what it comes down to is if you ask the wrong questions consistently, you're destined to get the wrong answers. Whereas in chiropractic, we tend to ask more expansive questions that are inclusive of multiple perspectives. And when you ask questions about life, and you ask questions about healing, and you ask questions about the cause and the root, you tend to get sometimes partial right answers, right? But partial right answers on a consistent basis, day after day, week after week, month after month, year after year, we then see that the results that we get are just not possible in other offices, in other medical practitioners, in other healthcare providers who only focus on symptoms. And it becomes so clear that when you treat a symptom, there's no possible way that you can get to the root cause. And so for us, it's about doing the hard easy versus the easy hard, and that the easy hard is let's just treat the symptom. You get all these side effects, and then 5 years, 10 years, 20 years down the road, you have these health challenges that have been so murky and unclear, versus you start under care and we start asking the right questions and we get a partially right answer, and we get closer and closer and closer and closer and closer and closer to the right answer. And in the end, we find that consistently, because of consistent right answers to the right questions, we get the best results because we actually see the root cause resolving. And that's just not possible in other offices. And so I invite you to be a part of this theme. I invite you to take part in our Instagram feed. I invite you to take part in our Facebook videos. And then also read the blog below, read Olivia's newsletter, read about all of the practitioners in the office, but most importantly, stay tuned as we get into our theme of the month. We're really excited to get to the root. We're really excited to kind of show you, kind of pull back the curtain on what that adjustment actually does and how it influences the body. Because when you do that, oftentimes it starts to blow your mind as to what's possible. When a patient comes in because their hip isn't moving correctly, and within the first few weeks of care, their chronic constipation goes away. Or a baby who's not latching properly, and we notice that there's something going on in the jaw, but then immediately they start sleeping better, or their colic goes away. And so in our world, the side effects also tend to be very positive, which is a miracle, right? So please stay tuned. Thank you so much for being a part of this year and also being a part of our consistent monthly newsletter, but also the themes and the videos and all of that. Stay tuned. We're excited to share with you.